This is the recording for the Occupational English Test, and the test is held at Xylem Language Center, Kottayam on 15th of January 2025. The candidate's name is Jesslyn Jose and the candidate number is 38125. The interlocutor is Nimnaga K and the interlocutor number is 12383. This is roleplay number 1 for the profession of nursing. Good morning.
Good morning.
May I see your identification, please?
Sure.
Thank you. This is a test of your English language and not an assessment of your professional knowledge. Keep that in your mind and speak naturally. We will begin with a warm-up session to get you started. This is not any way assessed. Are you ready?
Yes.
Can you tell me about your professional background?
I am a nurse with over 3 years of experience, primarily focusing on surgical and post-operative care. I have a strong passion for providing high quality care and ensuring overall well-being of my patients.
What do you do in your free time?
When I am free, I watch movies and series, and I also like to spend quality time with my family to get relaxed and recharge for my work.
That is the end of the warm-up session. Now we will move on to the role play. I'll take the part of the patient, carer or client and you will take the professional role. Each role play will last 5 minutes. The purpose of each role play is to show evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. You have 3 minutes to prepare for each role play. You will start the role play after that time. During the 3 minutes preparation time, you can ask me questions if you are unsure about anything. You can make notes on the role play card. You can look at the card during the test but must return it to me at the end of the test. This is the first role play. Please start preparing now. That is the end of the preparation time. Please start the role play.
Good morning. I'm Jesslyn Jose, one of the nurses working here. It's nice to meet you. Could I start by asking your name and age, please?
Good morning. I'm Rachel. I'm 28 years old.
Thank you, Miss Rachel. So tell me, how can I assist you today?
I work as a project head in VCU.
Okay.
For the past 2 months, I've been working for longer hours than usual. So it is causing a lot of stress to me.
Mm-hmm.
I cannot fall asleep even if I go to bed. And I wake up during my sleep frequently. And I feel tired all the time. I'm in a lot of stress.
Oh, I'm really sorry to hear that you have been feeling this way, Miss Rachel. It sounds like your job has been quite demanding, right? Isn't it?
Yes.
But don't worry, we can really work on it together. So to get a detailed picture of your present situation, I would like to ask you a few questions. Is that okay?
Yes.
Alright, so let's start with your work routine. Could you tell me about your work routine?
Usually I start my work at 10 or 10:30 in the morning and I finish by 7 or 7:30. But for the past 2 months I work till 10 or 10:30 to meet my tight deadlines. And during the break I cannot finish my household chores, so I finish my chores after the work.
Alright, what about your sleep cycle then?
I go to sleep at 2 or 2:30 in the morning, but I have to wake up at 6:30 in the morning again to send my child to school. Even if I go to bed, I cannot fall asleep easily. It takes a lot of time and I wake up during my sleep.
Okay, have you tried any treatments or remedies?
Yes, a few. I tried drinking chamomile tea to better to make the sleep better, and I even hired a household help to reduce my workload. But nothing helps. I still can't stop thinking about my tasks. I can't relax.
Mhm. Thank you for sharing that with me. I can completely understand why this has been so overwhelming for you. But please note that stress is a very common issue, and trust me, there are ways we can manage it together.
But I'm not sure about managing it because I've been trying for a long time.
Mhm. Being in your shoes, Miss Rachel, I can really sense how frustrating that must feel. It's really hard when you have been trying for so long without seeing the results. But I would say sometimes it's about finding the right combination of small, consistent changes that would really work for you. So let's take it step by step. All right, is that okay for you?
Okay.
The first technique that I would like to discuss is mindfulness. It simply means staying focused in the present rather than worrying about the past or future. So, if you ever get caught in a stressful situation, what you could try is deep breathing. That means try inhaling slowly through your nose for a count of 4. Try to hold it for another 4 seconds and exhale through your mouth for 4. Uh, are we on the same page?
Yes.
All right. And another method that I would like to bring your notice is exercise, the importance of physically engaged. Exercise is a great stress reliever, and I'm not saying that you have to do something intense. You can try even something even as simple as a short walk or gentle stretch that can do wonders for both your physical and mental health. So, would you feel comfortable trying any of these techniques?
Yes, I would definitely do that. How about improving my sleep patterns? Are there techniques for that too?
Yes, I was about to say that. So, about sleep technique, there are simple steps like sleep hygiene tips that you could try to improve your sleep quality. For example, creating a bedtime routine can help signal your body that it's time to wind down. Apart from that, avoiding screen time at least an hour before bedtime can also make a big difference too. And another thing that I would like to not say is about the importance of creating a sleep-friendly environment. Uh, it means setting your room dark, quiet, and cool, which is ideal to deal with your present situation. So, do you think any of this suggestion might be easy to try?
Yes, but nurse, what if I cannot stick to a routine?
Mhm.
How long will it take for me to feel better?
Oh, they are very reasonable question from your side, Miss Rachel. Let me say, it's absolutely normal to feel unsure about sticking to a certain routine at first, but let's start small. Okay, just 5 minutes of relaxation exercises or setting consistent bedtime routine to begin with, but over time, it becomes a part of your daily life. Okay, so is that clear for you?
Yes.
Hmm. All right, then Miss Rachel, I would like to talk about a follow-up appointment that I can arrange to check on how you are doing. And if you are okay, I can refer you to a counselor too, who specializes in stress management. If you feel that would be helpful. So, does that sound good to you?
Yes, that sounds great.
Mhm.
I'll try everything you said and I'll come for the follow up.
Okay, that's perfect, Miss Rachel. And you have taken a good big step now, and now you know that you are not alone in this journey. So, if you have any more questions or concerns, please don't hesitate to reach out. Take care.
Thank you. That is the end of the first role play.